11 million Canadians are living with diabetes or prediabetes. Chances are diabetes affects you or someone that you know. Hello, this is Robyn, registered dietitian and certified diabetes educator with Skhc Health Center. Today we'll begin by talking about what is diabetes. Diabetes is a disease where your body either doesn't produce insulin or it can't properly use the insulin that your body does produce. Insulin is a hormone that's produced by the pancreas, and its job is to regulate the amount of glucose or sugar that is in your blood. Blood sugars must be carefully regulated in order for the body to function properly. Too much sugar in the blood can cause damage to blood vessels, organs, and nerves. Your body also needs insulin to use that sugar in the blood for energy. There are three major types of diabetes, with type 2 diabetes being the most common. And this is followed by type 1 diabetes and gestational diabetes. Type 1 diabetes is an autoimmune disease, and it's also known as insulin-dependent diabetes. People with type 1 diabetes aren't able to make their own insulin and therefore can't regulate their blood sugars properly. And this is basically because their body is attacking their pancreas. Type 1 diabetes affects about 10% of people with diabetes. Now, type 1 generally develops in childhood or adolescence, but it can also happen in adulthood. People with type 1 diabetes will need to either inject insulin or use an insulin pump to make sure that their bodies have enough. Now moving on to type 2 diabetes. This is where the body is either not able to properly use the insulin that you have, or it's not able to produce enough insulin for what you need. Type 2 diabetes affects about 90% of people living with diabetes. Type 2 diabetes commonly affects those in adulthood, but it can also happen in childhood. It can sometimes be managed through healthy eating and lifestyle choices, but it does sometimes require medications and/or insulin. And finally, there's gestational diabetes. This is a type of diabetes that happens in the second or third trimester of pregnancy, and it affects anywhere from 3 to 20% of pregnancies. So in most cases, people with gestational diabetes did not have diabetes before their pregnancy, and they will not continue to have diabetes after their pregnancy. It typically goes away. There is also something called prediabetes. Now with prediabetes, blood sugars tend to be higher than normal. However, it's not quite at the point that we would consider it type 2 diabetes. Although not everyone with prediabetes will go on to develop type 2 diabetes, many people will. And if left unmanaged, the risk of developing type 2 diabetes increases. So taking steps to manage your blood sugar levels can help prevent or delay type 2 diabetes. So the key is really a healthy lifestyle. Now, what are the symptoms of diabetes? How do we know if we have it? Well, the classic symptoms of diabetes tend to be unusual thirst, fatigue, frequent urination, and unexplained weight loss. In type 1, the symptoms usually progress fairly quickly and it can be quite dramatic, whereas in type 2 it's slower to progress. However, it's important to note that many people with type 2 diabetes may have no symptoms at all, and it might be found through a routine doctor's visit. If you or someone you know may have type 2 diabetes, please contact a doctor or a healthcare provider. Now, there's no single cause of type 2 diabetes, but there are some factors that put you at greater risk for developing it. So this would include being age 40 or over, being overweight, having a family member with diabetes, having had gestational diabetes, having given birth to a baby that weighed more than 4 kilograms or 9 pounds at birth, high blood pressure, high cholesterol or other fats in the blood, and being a member of a high-risk ethnic group. So that would include First Nations, Inuit, and Métis people. Now, there are some things that you can do to either prevent or postpone type 2 diabetes. Number 1, maintaining a healthy weight. It's important to include a good balance of activity and healthy eating, and you should talk to your healthcare provider about what a healthy weight looks like for you. Number 2, eating a healthy, well-balanced diet. So I talk about this in a lot of my nutrition videos, but this would be things like following Canada's food guide, getting a variety of foods, a diet high in fruits and vegetables, watching those saturated trans fats, and aiming to include more fiber, watching your sodium and sugar intake, limiting alcohol, and watching your portion sizes. Number 3, ensure regular physical activity. So it's recommended that we get about 30 minutes a day or 150 minutes throughout the week. Try to include activities that incorporate endurance, flexibility, strength, but also keep in mind to include activities that you or your family enjoy. Number 4 is don't smoke. So remember, if you already smoke, it's never too late to quit. And please speak with your healthcare provider if you'd like resources or support with help quitting. And also avoiding secondhand smoke. And finally, number 5, keep your health in check. Making sure to get enough sleep, enough rest, being active as a way to reduce stress, and managing if you have other conditions like high blood pressure, high cholesterol, for example. Now, people who do have diabetes are at risk for complications. So consistently high blood sugar levels can affect things like the heart, blood vessels, eyes, nerves, teeth, and kidneys. And in addition to that, people with diabetes are at higher risk for developing infections. Now, maintaining your blood sugar levels to target and watching your blood pressure, cholesterol, etc. can delay or even prevent these diabetes-related complications. And that's why monitoring in diabetes is so important. So whether that includes your self-monitoring, so checking your blood sugar levels, and following up at your regular doctor or healthcare provider appointments. If you have any further questions, please feel free to reach out either to myself or any other doctor, healthcare provider, certified diabetes educator. Thank you for watching today's diabetes video, and I'll see you in the next one. Bye!